Hello and welcome to a special interview for The Wire supported by Glenlivet Books. Prima facie, the COVID situation in Kerala is confusing. On the one hand, cases are down, as well as the R number, which has fallen below 1. But on the other hand, tests are also down, and the test positivity rate seems to stay stubbornly above 15%. So today we ask, if we look deeper into the statistics, could the picture become clearer? That's the key issue I should explore today with one of India's most renowned health economists, adjunct professor at the Rajagiri College of Social Sciences in Kochi, Rijo M John. Professor John, I want to focus exclusively on Kerala in this short interview. I noticed that the 7-day average of daily cases has been slowly but steadily declining. It was 21,867 on the 15th of this month, and then it fell almost 13% to 19,080 on the 22nd. But at the same time, depending upon which two dates you choose, testing has also come down, somewhere between 10% depending on the dates you choose, or 14%. And that leads to the question, is this a real decline in cases, or is it a result of the fact that testing is coming down, which, if that is the case, would mean it's somewhat misleading?
So, Karan, instead of looking at two random days to compare these kind of numbers, I would like to see the local peak that we had. That was, post-Onam surge that Kerala actually saw. It sort of peaked on 30th of August. Okay, so I'd like to compare my numbers based on the day on August 30th when the cases actually peaked in the present surge. So from that day, when I compare, since then, the 7-day average of cases, test and test positivity rate all have declined. And the decline in cases has been slightly higher than the decline in testing itself. But because this decline in TPR has been relatively quite low, I would, say only part of this decline in cases is genuine, while the other part should be attributed to decreased testing. In fact, if you compare with the August 30th, you would see the daily testing was around 1.6 lakhs per day around those days, and it is now down to 1.1 lakh, and that's more than a 30% decline. It really, not, in my opinion, not a good strategy to reduce testing at a time when the TPR is still high.
You've been following this closely, so can I ask, since the 30th of August till today or yesterday, how much have cases declined by and how much have tests declined by?
Well, the cases have declined, or I'm only talking about the 7-day moving averages. So from the day 30th, there has been a 36% decline in cases and a 30% decline in testing. And there is also a 15% decline in test positivity rate, which is not as significant as the decline in cases. So that is why I said, a part of the decline can be genuinely a genuine decline, while the other part is, because of a decreased testing, which is significant decrease in testing of 30%.
Absolutely. I just underline that. The decline in cases in terms of the 7-day average of daily cases since the 30th of August, that decline in cases is 30%. The decline in tests is 30%. Sorry, one is 36, the other is 30. And that means that cases have declined 6% more than tests, which is why you say the decline in cases is real, but not entirely so. A lot of it is also because tests have declined. Let me at this point raise a critical issue of concern for the central government. They say that Kerala has a very high and persistently high test positivity rate. Now, I note that compared to the 30th of August, it's declined roughly 50%. But it is still somewhere around 15.5, 15.6%. Why is it so high?
Well, I think it is right. The center is right in saying the TPR is indeed quite high and has been so for a very long time in Kerala. In fact, if you look at the trajectory of the pandemic in Kerala, you would see that Kerala had a relatively higher test positivity rate all through. When cases plateaued after both the first and second wave, it had a very prolonged period of high test positivity rate. After the first wave, it was hovering around 10 to 11%. And now, even after the second wave, it was at 11, 12, 13% for a very long time. But it again, in the recent surge, it went up. But it is now coming down, but gradually. So, there can be many factors that result in a high TPR. If you actually conduct test only after effective tracking and tracing and among highly suspected persons, the TPR may be high. However, I'm not sure if this is the reason why the TPR continues to be high in Kerala at this time. Now, the type of test can also affect the TPR. Given that antigen testing returns a higher number of false negatives, the TPR estimated from a mix of testing with a high share of antigen test would have a low TPR and vice versa. Now, at the time of its recent peak on August 30, the antigen share in the total testing in Kerala was 45%, the rapid antigen test share. Now, at the moment, as I'm speaking on the last 3-day average, last 7-day average, it is now down to below 30%. So this must be having an increasing effect on reported TPR. Now, to make it simple, if let's say if Kerala had the same share of antigen testing in its daily testing now as it was in late August, the TPR today would have been lower than what it is.
So, I just simplify that. Yeah. The point you're making is that one explanation for the fact that Kerala seems to have a worryingly high test positivity rate is since the 30th of August, the share of RT-PCR tests and the share of antigen tests has altered. It used to be 65% RT-PCR, 45% antigen in the 30th of August. Now it seems to be 70% RT-PCR, 30% antigen. And that means because RT-PCR is more accurate, it throws up more positive results. And that could explain the high positivity rate.
That's right. I mean, so I would say the current high test positivity rate, this is one of the factors that is potentially contributing to a higher continued test positivity rate at the moment, in my opinion. Yeah.
You say one of the factors. Is it a sufficient factor to explain away the high test positivity rate, or even after this factor is taken into consideration, are you still worried about the high TPR? Because the high TPR is still 15.5%.
Yes, absolutely. I'm still worried about the high TPR, and that is one of the major reasons being the reduction in the testing itself. If we had continued at the same 1.6 lakh or more average daily testing, the TPR would have been much lower than what it is. I mean, that's simple mathematics. You increase the denominator significantly, it is going to reduce the TPR. So a drastic reduction in testing has also is showing up in a very high TPR.
This is, in a sense, the second consequence of reducing testing by 30%. The first consequence we discussed earlier, it makes it seem, in fact, there's a real decline in cases, whereas some of that decline in cases is only because testing has come down. But the second consequence of testing coming down is your TPR goes up, and it goes up worryingly high. So both consequences flow out of the fact that you have reduced testing levels at the wrong time.
Absolutely, absolutely.
So the consequence, or in a sense, the conclusion of this part is that Kerala made a terrible mistake in reducing testing levels at this particular point of time. It should have persisted with high testing, not reduce it.
I agree. In fact, Kerala had shown that it has the capacity to even carry out nearly 2 lakhs daily testing. It had done close to 2 lakh daily testing on multiple days in the past, in fact, early August. So, and I was surprised that why the state would reduce the testing so significantly. It's a very significant reduction, and I would like to see at the current TPR, I would ideally like to see more than 2 lakh daily testing being done in Kerala.
And in fact, we're averaging somewhere around 105, 110 at the moment, aren't we?
Absolutely. Yes, that's right.
So from the peak, testing is down by almost 95 or 90,000 a day. But from the 30th of August, it's down 30%. That is an indication of how much Kerala has reduced testing at the wrong time. Now, let me at this point, Professor John, put to you an argument that was made to me just a couple of days ago by the director of the National Center for Disease Control, Dr. Sujit Kumar Singh. He said that given up to 90% of Kerala's population have had one jab, and second, he said, given that on the basis of biostatistic assumptions, Kerala's seropositivity level could now be assumed to be 70%, the continuing high TPR level, which is not declining sufficiently and hovers around 15%, he says clearly indicates that Kerala is not observing COVID appropriate behavior properly. And secondly, it indicates that home isolation, which is how 80% of Kerala's patients are treated, is not being monitored and is often being breached. How do you respond to that argument?
Well, if you allow me, I would take it in two parts. I'm not sure what the biostatistics assumption is referring to, but I can make some simple back of the envelope calculation here. For example, Kerala's seroprevalence was 44% at the end of May, when and at that time the single dose vaccination had reached barely 20% of its total population. I'm referring to the ICMR's last ICMR sero survey here. Now, since then, the state has actually reached a 70% single dose coverage for vaccination of its entire population till now. And it also reported, since over the last 4 months, it has also reported an additional 2 million infections, which are actually more than 5% of the state's population. Now, assuming a similar level of undercounting of cases as it used to happen in Kerala, I mean, of course, like any other state, I would say the undercounting factor is much lower. But if I assume the same kind of undercounting that was happening in Kerala earlier, I would say this 5% reported additional cases is equivalent to almost 25% to 30% of the population infected additionally in the last 4 months. So earlier already the sero survey shows that there is a 44% seroprevalence, and you have another 25 to 30% infected over the last 4 months, and then you also have this 70% of the population having got at least a single dose. So I would say
the percentage of the population with a single dose is surely much higher than 70%. It's close to 90.
Now that's for the adult population. 90% is only for the
You're
adult.
distinguishing between adult population and total population. Total population is 70%. Adult population is 90. My apologies.
That's
carry on.
That's right. So based on all these numbers, and I can safely say that the state must have reached at least 70 to 75%, if not more, seropositivity by now. Now, Kerala is doing a seroprevalence survey on its own, and I believe it's underway. It was supposed to be happening in September. So that should probably give a correct answer to it. Now, coming to the second part of the question, the increased TPR may not be because of COVID inappropriate behavior, as in general as such. Because, I would say, it could actually be because of the increased emphasis on home isolation itself in Kerala. In fact, it is well known that the household attack rate is very high for the Delta variant, and Kerala has been increasingly allowing home isolations during and after the second wave, unlike the first wave when more institutionalized quarantines were in place. So it is very difficult to monitor home isolation or observe COVID appropriate behavior within the confines of one's own home. People living living with a COVID positive person at home are highly susceptible, and so this increased emphasis on home isolation of positive cases may have been an important factor contributing to a continued high TPR, in my opinion, apart from the other factors that I already discussed earlier that are contributing to increased TPR, like reducing the share of antigen, etc.
Yeah. You're making a very interesting point. You're saying, and this is where you disagree with Dr. Sujit Kumar Singh, that the high TPR persistently around 15% is not an indication of lax COVID behavior, but you do agree with the second part of his argument that this does suggest that Kerala needs to rethink home isolating up to 80%, because in home isolation, the secondary attack rate, particularly of Delta, is very high, and people in the home catch the same infection, which is why the numbers are going up. What about his other point that many people in home isolation are actually breaching home isolation and wandering around outside, and that's the reason why infection is spreading? Could that be correct?
Well, I mean, that's difficult. We don't really have sufficient data to prove that. But, as I already emphasized, monitoring home isolation is a very difficult task. It's practically impossible, I would say. People might be reaching out. I can't vouch for it, but I wouldn't be surprised if they do, because there's already Kerala has been going through a very long, lockdowns in various forms and shapes. So the fatigue must be kicking in, and I'm sure it is there very well. And
but
I wouldn't be surprised. Yeah.
Can I interrupt? The point you're making is Kerala needs to rethink isolating up to 80% of COVID patients at home, because home isolation means that others around you pick up the infection, and as a result, the TPR stays high. So that policy of emphasis on home isolation, you're saying, should be rethought. Is that a correct conclusion?
Absolutely, absolutely.
Let's at this point come to another statistic from Kerala, which puts the Kerala COVID situation in perspective. I'm now talking about hospitalization, and I'll talk about all three phases together: admission, ICU treatment, as well as ventilators. In the last 3-4 weeks, have these gone up or have they gone down?
Oh, well, that's a good question. Fortunately, the rate of hospitalization and serious cases are showing a steady decrease in Kerala at the moment, a steadily decreasing trend. In fact, when I look at the numbers, it shows there has been a 24% decrease in persons in hospital isolation over the last 3 weeks alone. Now, if you compare with the previous week, the number of patients admitted in ICU, ventilator, and oxygen support has reduced by 6%, 7%, and 10% respectively in this week compared to the last week. So that's a significant improvement there. So this is why when I initially said, the part of the declining cases is genuine, and this actually shows that there is indeed a genuine decline happening.
This is a very important statistic. I'm just repeating it so the audience can be clear about it. You're saying in the last 3 weeks, admissions to hospitals have declined by 24%. ICU treatment has declined between 6 and 7%, and ventilator requirement by 10%.
Yeah, I mean, ventilator by 7% and oxygen support by 10%. Yeah.
Okay. Ventilator by 7%, oxygen by 10%. 5 or 6 weeks ago, just after he returned leading a mission sent by the central government to Kerala, Dr. Sujit Kumar Singh said to me in an interview that he was particularly concerned about hospitals in the northern districts of Kerala. He said these were under stress, and he specifically cited the example of Malappuram, where he said hospitals were 90% full. Does that continue to be the case, or has the situation eased since then?
Oh, well, the situation has changed significantly, and it has certainly improved. It is true that Malappuram had once come pretty close to exhausting its infrastructure at some point, but it has improved vastly. Not a single district there currently with the hospital ventilator ICU capacity being exhausted, not a single one. In fact, in Malappuram and Kozhikode, both northern districts, about 17% of the COVID ventilator capacity is still available and is steadily improving over the days. And in Kollam, which is actually a southern district, it's about 9%. The capacity is still available, 9%. And in all the other districts, it is vastly better than this. I mean, it's mostly like 30%, 40% capacity still being available in all the other districts. So yeah, I mean, the situation is fast improving. Yeah.
This is very interesting, the point you're making. In terms of hospitalization, the situation is improving vastly. Overall, you said, hospital admissions in the last 3 weeks are down by 24%. ICU and ventilator requirements down by 7%, oxygen down by 10%. And then speaking specifically about the stress on hospitals in the northern districts, which Dr. Sujit Singh was so concerned about, you say the situation has changed significantly. It's improved vastly. Those were your words. So in terms of hospitalization, there is no real stress in Kerala at the moment at all.
Oh, yes, we are past that phase, yes.
And your main concern, therefore, is to do with testing coming down. There's no doubt that cases have come down, but because testing has come down very significantly, a lot of the reduction in cases is because of testing and not a real reduction. But that said and done, there is still a small real reduction in cases. And your other concern is the persistently high TPR levels, which are hovering around 15.5%. And to be able to bring that down, not only must testing increase significantly back to the levels it was at of around 2 lakhs a day, but also the government in Kerala should rethink its policy of home isolating up to 80% of patients, because in home isolation, everyone around you ends up getting infected. The secondary attack rate of Delta is very high. Have I correctly summed up all of that?
Yeah, because you got it right. Yep.
Then my last question, and I didn't bring this up earlier, but I'm deliberately bringing it up now. The Hindu reported yesterday that the R number in Kerala has fallen below 1. And the Hindu was citing the Indian Institute of Mathematical Sciences in Chennai. I think they were citing Mr. Sita Bras Sinha. If it's correct that the R number has fallen below 1, does that suggest to you, despite all the concerns we've mentioned, that Kerala has either turned a corner or is in the process of turning a corner?
Yes, I believe the worst is already behind for Kerala, to be frank. And in fact, you don't even have to look at the R number. The falling hospital utilization itself is a major significant indicator for that. And the state, on the positive side, has already vaccinated more than 96% of the 45-plus-year-olds with a single dose and 56% with a double dose. That's comparable to anywhere in the world. In the absence of emergence of a new variant against which the current population immunity doesn't help, I think there is no need to worry for Kerala, and the worst is already behind us, as far as I'm concerned. Yeah.
I'm very glad to hear that. Your exact words are the worst is behind Kerala, to be frank. In other words, Kerala has turned a corner. It's improving. That is the future. Is that right?
That's right. That's right.
And the other very important thing you said, and I'm picking it up because I think it's very significant, is that speaking specifically about the population that is over 45, and correct me if I've remembered the statistics wrongly, 96% of over 45s have had a single dose, 56% of over 45s have had a double dose. This is very important because this is a subset of the broader figure that we keep quoting, that up to 90% of the adult population have had a single dose, pretty close to 34% have had a double dose. This subset of people over 45 is perhaps the most significant because these are the most endangered people because of their age. Is that right?
That is very right. Yeah.
And those figures of 96 and 56 were correct?
Correct. That's correct.
Professor John, I thank you for this interview. You've helped us understand Kerala in proper perspective by looking deeper into the data. And clearly what was for many a confusing picture now becomes much clearer and sharper. And the line I want to leave them with, and I'll be quoting you, is the worst is behind Kerala, to be frank. Thank you very much indeed. Take care.
Thank you.
Stay safe.
Thank you, Karan.